coming to an important topic, inflammatory bowel disease. This is also, what are the inflammatory bowel diseases?
Crohn's
disease and ulcerative colitis.
Yeah, Crohn's disease and ulcerative colitis. Okay. So this is a topic which is important even in medicine, pathology, and surgery. Okay. So pay little attention. We have 5 slides here. So just see here. This table, this is something related to Crohn's. This part, this all is related to Crohn's. This is ulcerative colitis. Okay. With this, don't write anything. Just listen once. I'll give the slides to you. Okay. You are with me? Everybody listening? Yes?
Yes, sir, listening.
Yeah, this is a little important. Okay. So, Crohn's disease, this is an incurable disease. Smoking predisposes it. Smoking predisposes it. Inflammatory bowel disease, the chromosome is 16q. These are all not important, but just ulcerative colitis is curable disease. Smoking prevents it. Okay. This is the only useless disease where smoking prevents it. We can advise the patient to smoke to prevent ulcerative colitis. Okay. And inflammatory bowel disease 2, the gene is on 13q. So this is just an introduction for, this is about Crohn's and this is about ulcerative colitis. So what is this basically? Inflammatory bowel disease. What is inflammation?
Redness.
It's a defense mechanism towards sort of infection or
any infection or any insult. Okay, it's a defense mechanism against any insult. So here it is an inflammatory bowel disease. It's a disease of the bowel, both large and small bowel. Okay, so this occurs from mouth to anus, anywhere from mouth to anus. Okay, but rectum sparing will be there. Rectum is never involved in Crohn's disease. Okay. Yes.
Yes, sir.
And the most commonly involved part is the terminal ileum. The most commonly involved part is the terminal ileum. Okay. From mouth to anus, anywhere it gets infected except the rectum. And the most common part is terminal ileum. Crohn's disease occurs most commonly in ileum, cecum, colon, and rectum. Okay. That is the answer is ileum. Crohn's disease never occurs in ileum, cecum, colon, and rectum. The answer is rectum. Okay. So that is one thing. Then ulcerative colitis, it occurs up to the cecum only, from retrograde, from the anus, rectum, anus, up to the cecum only. It doesn't involve the small bowel, it doesn't involve the stomach, it doesn't involve the esophagus, it doesn't involve the mouth. Okay, only the large bowel only, up to the cecum. Okay, that is retrograde, up to the cecum. And here anus sparing will be there. Anus is spared here. Okay, got it?
Got it, sir.
And the most common is rectum. There the rectum is not involved. Here rectum is involved, and it is the most common thing. And there will be backwash ileitis. Ileum sometimes because of the backwash, because of some obstruction, there will be backwash, and ileum is involved in such way. Okay. So what is the presentation? The patient can present with stricture or fistula in Crohn's disease. The most common feature is a pain abdomen. He will have pain abdomen because of stricture or fistula. The other things are there may be bleeding, there may be diarrhea. Earliest is the presence of an aphthous ulcer inside. If you do a colonoscopy, you can identify an aphthous ulcer. There may be stricture or fistula obstruction. These are all the presenting features of Crohn's disease. Whereas in ulcerative colitis, the patient will have proctitis or colitis. So the most common presenting feature is diarrhea. He will have diarrhea. He will not have a pain abdomen. He will have diarrhea. Large bowel only is involved. So he will have diarrhea. There is chance of perforation, and the colon will increase in size. There is toxic megacolon. Up to 16 mm it will increase. Okay, the colon will become bigger. Okay, up to 7 to 8 centimeters it increases. Okay, that is known as toxic megacolon. Next, extra intestinal manifestations. Apart from intestinal manifestations, there are some extra intestinal manifestations. Out of this, remember only the important ones. Most common is erythema nodosum. In Crohn's disease, it is the erythema nodosum. Okay, see here, small, this red papy nodules are there, right? These are known as erythema nodosum. Okay. Whereas in ulcerative colitis, there is pyoderma, infection of the skin, pyoderma. Okay. Simple.
Okay,
It is erythema nodosum here, it is pyoderma here. And can somebody tell me what is this PSC? PSC. Primary.
Is it cirrhosis, sir?
Primary sclerosing cholangitis.
Oh, okay.
Primary sclerosing cholangitis. Yeah. The peculiarity of this is other symptoms are there, right? Pyoderma, uveitis, hepatic fatty liver. Everything will be cured once the disease is cured, but this will be persistent. So that is the peculiarity of this primary sclerosing cholangitis. Okay. And pathology. There is serpentine ulcer, snake-like ulcers here. There is transmural involvement here. That is, suppose this is the intestine. That is the 4 layers. Everything is involved. Transmural involvement. Okay. Complete bowel is involved. Transmural involvement. Are you getting my point?
Yes, sir.
Yes, no?
Getting you, sir.
So
Yeah.
even associated with this is CD, right? Okay. For
Sorry?
ankylosing colon spondylitis also right now.
Yeah, ankylosing spondylitis also is there. Yes. So serpentine ulcers will be say transmural involvement. That is, whole of the bowel will be involved. The whole wall of the bowel is involved. Transmural involvement. There is mesenteric fat wrapping. What happens is the mesentery will be there, right? The mesentery will go and it overlaps the bowel. It overlaps. It forms a wrap around it. And there is presence of skip lesions. What is the skip lesions? Suppose if this is the bowel, Crohn's disease, it will be there here. A small part will be normal. Again, it will be there here. This will be normal. Again, it will be there here. There is presence of skip lesions.
It is also known as kangaroo lesion, sir.
Sorry?
It is also known as kangaroo lesion.
Yeah. And then there is appearance like cobblestone appearance. Okay, the lesion will appear like cobblestones. Cobblestones are the pavement stones. They will be appearing like cobblestones. Okay. And finally, there is non-caseating granuloma, formation of non-caseating granuloma. Okay. And whereas in the same, if you see here, there is collar button ulcer. Here serpentine ulcer, here it is collar button ulcer. Here it is transmural involvement, but here only there is partial thickness involvement, only partial thickness. There is no fistula or stricture. It is a continuous lesion. No, it is not a
skip or kangaroo.
skip lesion. Yeah. There is formation of pseudopolyps. Here there is formation of granuloma. Here there is formation of pseudopolyps. Instead of cobblestones, there is cryptabscess or toxic megacolon here. So this slide is the most important slide for your MCQ point of view and NEET also. So they will give which of these finding out of this. These are just like one-liners. Serpentine ulcer will be there. So you have to pick Crohn's disease. Transmural involvement will be there. You have to pick Crohn's disease. Okay. Skip lesion is there. Pick Crohn's disease. Continuous lesion is there. Then what you'll pick?
Ulcerative colitis.
Ulcerative colitis. So to remember, just remember with this mnemonic. So see here, M master. See, M is mesenteric fat wrapping. A is granuloma. S is skip lesion. T is transmural involvement. C is E is cobblestone. E is cobblestone. E stone. And R is ulcer. It is serpentine ulcer. So you practice this. You memorize this. These 6 findings are these 6 findings belongs to which one? CD or ulcerative
Crohn's
colitis?
disease.
So these 6 findings belongs to Crohn's disease. Okay. So just memorize this 6 things: mesenteric fat wrapping, granuloma, skip lesion, transmural involvement, cobblestone, and serpentine ulcer. If these 6 are for Crohn's disease, then what are the other 6? Instead of skip lesion, what will be there? In ulcerative colitis, you have to tell me.
It's a continuous lesion.
Continuous lesion. Okay. For serpental ulcer, what ulcer is there? Serpental ulcer.
It's a collar button also.
Collar button ulcer. Okay. For cobblestone,
Cobblestone, it would be
crypt abscess.
Crypt
Remember
abscess.
crypt abscess. There is just a pavement appearance, right? So there is crypt abscess formation there. Transmural involvement,
partial thickness
Partial.
here.
partial thickness. Okay. Granuloma,
Pseudopolyps here.
pseudopolyps. And mesenteric fat trap. For this, remember toxic megacolon. Instead of fat is wrapping around, the colon is increasing in size. This is toxic megacolon. Okay. 6 into 2, 12 points are with you, right? Yes, no?
Yes.
Yes, sir.
Okay. So memorize 6 and after that start memorizing the other 6. This is very, very, very important. Okay. This will be there with you for FMG. If you afterwards, if you write your PG entrance, and if people who take medicine, surgery, we will leave it. But people who take medicine, even for a DM exams also, this will be useful. Okay.
Okay, sir.
Yeah. See here, this is the cobblestone appearance. See here, this is the cobblestones. This is the cobblestone appearance. And this is the transmural inflammation. Whole of the bowel is involved. What is this?
Skip lesions.
Yeah. The bowel is, the lesion is here. 1. See, here there is a lesion. Here there is a lesion. Here there is a lesion. And another thing is obvious here. What is the another thing obvious in this picture? Can somebody tell me? I'll be satisfied that this is skip lesions is there. Okay. And one more thing, which is an important finding of Crohn's disease. What is this?
Transmural involvement.
What is this? This part, anatomically.
Anus.
Anus. So what is this?
Cecum.
No, cecum is here.
Sigmoid.
Colon.
Rectum.
Sigmoid.
So now tell me what you are seeing here?
Sparing of rectum.
Very good. You are seeing sparing of rectum. Excellent. Okay. So this is the classical thing of Crohn's disease, sparing of rectum. Okay. Good. Yeah, and still it is not over. This still continues. The investigation of choice is capsule endoscopy here. In Crohn's disease, it is capsule endoscopy, whereas in ulcerative colitis, it is colonoscopic biopsy. You put a colonoscope and take a biopsy. Okay. So various signs in barium enema. Just remember one sign: garden hose pipe. Both are pipes. This is garden hose pipe. This is lead pipe. Ulcerative colitis is lead pipe. Barium is garden hose pipe. So we'll see what is that. See here. This is hose pipe appearance. Hose pipe. You can't differentiate it. And don't worry, they will not ask this also. They will not show this also because it will not be clear. But just remember, hose pipe appearance is seen in Crohn's disease. Lead pipe appearance is seen in ulcerative colitis. Okay, just remember these two things. Complications. Most common cause of death in both is cancer. They are pre-malignant conditions. They move on to cancer. Okay, so treatment part here. If there is single stricture, one minute.
Sir, Crohn's pre-malignant condition?
Yeah, both are pre-malignant.
Okay, sir.
Yeah. Ultimately, they will lead into malignancy. Where is this? Yes. So see, you can give this medical management: aminosalicylic compounds, azathioprine, steroids. Steroid is a drug of choice for Crohn's disease, or monoclonal antibodies. But ulcerative colitis, you have to remove the whole, because whole of the bowel is no sparing here. Whole of the you have to remove the whole of the large bowel. Total proctocolectomy. Large bowel along with the rectum, and what is left behind? Ileum is left behind. You have to do ileum and anal anastomosis. This is for ulcerative colitis. Whereas in Crohn's disease, you can't take it out because it is multiple skip lesions will be recurring. So just do a stricturoplasty. Whenever there is stricture, just do a stricturoplasty. Okay. Polyps. In this, just remember